We'll be discussing about the visa route for healthcare assistants, carers, and social workers. Okay, so as we all know, it's no longer a news that these jobs are on high demand in the UK at the moment. Okay, these jobs has been placed on shortage occupation list, just the way nurses, doctors migrate to the UK from all over the world. The same way these jobs are now on shortage occupation list, and it means that people can be recruited from all over the world to fill this role in the UK. Okay, so if you're there in your home country and you've always wanted to come to the UK, this is a wonderful opportunity for you. Welcome back to my channel. It's your girl Asa Legend, and if you're seeing my face for the first time, please subscribe to my channel and press on the notification bell so that whenever I upload my video, you get to see them. Okay, and to all my returning subscribers, you all are the best. Thank you. Good news is that you don't necessarily need to have any health background, like being a professional in health related matters. Even if you study art in school, you can still apply for this role, because according to the UK statement, the applicants do not need to have any formal qualification to be eligible to visa route. Will only last for 1 year. Okay, it will be launched on 15th of February, this coming 15th of February, so it will last for whole 1 year. Before you apply, you need to know what you are applying into. Okay, so I will quickly tell us who a healthcare assistant is. All right, so a healthcare assistant is someone who assists a patient either in the hospital or in the patient or in residential care homes or in patient's own home. Okay, they also assist nursing staff to carry out some activities. Okay, requirements for this job role. All right, so normally there is no formal qualification for you to apply. Okay, but then you need to stand out, because this offer is open for everyone all over the world, so it's quite competitive. It's not gonna be easy. If you're not from a major English speaking country, okay, and most African countries are not major English speaking countries, so you need a proof of your English language proficiency, because you're coming over to the UK. This is English speaking country. They want to be sure that you'll be able to communicate with the patient. Okay, so you need to prove that you can speak good English, and this is usually done through IELTS exam. Passing your IELTS exam, and for this job role, what you need is minimum score of band 4. And believe me, for someone who already speak and understand English, if you go for this exam, you will definitely get that band 4. Okay, so the IELTS will be academic UKVI, because it will be used for your immigration processing. Okay, so another thing that I think you will need to make you to stand out is that you need to get some work experience. Okay, either through volunteering. If there is any local hospital around you, you can maybe volunteer to go there and work for a month or two, just to have something to put CV. Okay, a doctor to apply. But if you're preparing your CV, what are you gonna write in the CV? You need something that will make someone that wants to employ you to see you, something that will make you to stand out, something that will entice them, something that will tell them that you are the right person for the job. And that is why you need to get this work experience from any hospital around you, just to pen it down in your CV. And also, you can hunt for all these health online courses. There are so many free online courses that you can do and get your certification. If you get that certificate, it will also help you to see what you're writing in your CV, so that when you submit your CV and they read it, they will say at least this person has some basic knowledge. So online courses you can do that will be valuable for this job are things like basic life support. If you come across online basic life support, please do it and keep your certificate. Okay, I will send one free online link for you to do your basic life support in the description box, so it will be in the description box. Okay, go to it, click on the link and do the course online and get your certificate. So other online courses I suggest you can do is infection control, safeguarding, and maybe fire safety. Just do few of them so that you will use it and update your CV. It will make you to stand out, okay? So another thing that you will need is to prepare your CV. Get your CV ready. If you see those recruiting, apply. All right, so you need to start now. It's going to be launched on 15th of February, but this is just the time for you to start hunting for this job. You don't need to wait until 15th of February for you to start applying for the job, okay? So another thing that is important is police clearance certificate, okay? This is used for immigration purposes as well. One thing that you need to add while preparing your CV are your skills, because you need to show that you have some transferable skills in order to care for this patient. So skills like being caring, being compassionate, that you know the value of respecting people's rights and their dignity. They are very important. An ability to assist people, okay, in carrying out their daily life activities. So these are the skills that you need to include in your CV to show them that you are the person for the job, okay? So having talked about the requirements, I will quickly discuss the role of a healthcare assistant. The job description is, first of all, you help patients, you assist patients in their activities of daily living. Whatever it is that they cannot do for themselves, you're there to assist. Patients cannot access the toilet themselves. The patient might need your help to get to the toilet, or you may need to start them commode or wherever, okay? So another role is lifting patients using equipment. But when you come over here, I'm sure they're gonna train you on manual handling so that you know how to use equipment and lift patients. Another role is helping patients to eat. So because there are some patients that cannot feed themselves, you help them to eat, you help them to mobilize, you reassure them, you take their vital signs, you assist them. So these are the things you do for them, okay? So the next thing is how to apply, okay? So first of all, you need to go and maybe volunteer for any healthcare role in hospital around you. Volunteering job maybe for 1 month or 2 months. You won't necessarily need to work there for a long time, maybe twice a week or so. It's just for you to have experience and to have a referee, someone that will say, yes, this person has got some experience in this hospital. So when you get the work experience, you start now to prepare for your IELTS. You don't really need to do long preparation, you know, maybe 2 weeks preparation, but believe me, getting band 4 is way easy, okay? So you sit for your IELTS, okay, prepare your CV, start hunting for jobs. If you go online, there are different agencies that are recruiting. You can send them mail. There are some agencies that I know, but I will do a separate video for that on agencies recruiting so that maybe you will go through it, okay? But one thing I want to tell you, if you come across any agency online, maybe on the Facebook, beware of scammers, okay? What if any agency asks you to pay them? Please don't pay them, okay? They don't need to charge you for anything. Like when I came over to the UK as a nurse, okay, I came through one agency like that. They did not ask me to pay them. The normal rule here in the UK for this, the way they operate is that when they recruit people internationally, it is the company that are bringing you to, the hospital that are sending you to, or the care home that are sending you to will pay them off. So you are not giving them any money for helping you to get the job, okay? So if any of them asks you for payments, run. Don't pay anybody. So the minimum salary that you're expected to get in this job role is around £20,480, okay, per annum. All right, so when you break this down to hourly payments, it's like £10.10 per hour, and it's fair enough, okay? With that kind of amount, you can earn a decent living here in the UK. And one good thing about this visa route is that you can come with your family, okay? You can come with your family. The contract may be for 3 years, for 5 years or so. You can come along with your family. If you have a wife, kids, you can come with them. It's wonderful. For health surcharge, I don't think this visa route needs you to pay for immigration health surcharge because it's under health and care worker visa. Health and care worker visa do not, people in this group of visa don't pay for health surcharge. So health surcharge is not included. Even for your dependents too, they don't have to pay for health surcharge. So another thing is that when you eventually find agency that is willing to recruit you, or a licensed company that is willing to employ you, they might ask you that you will be the one to pay for your visa, your flight fee and everything. When you come over to the UK, they will refund you. That one is different, okay? Because most of the care homes, they don't pay all these things for you while you're still in your home country. It's when you come over to the UK that will refund you, okay? So that one is a difference. I wish you all guys the best. A quick disclaimer, please, I am not an immigration lawyer or advisor, okay? This video that I've made is solely based on my own research and my own opinion, okay? So don't quote me anywhere. Don't quote me. I'm not an immigration lawyer or an advisor. I'm just someone who researched, and I'm now sharing my own ideas to you guys. If you haven't subscribed to my channel, please, what are you waiting for? This is the month of love. Show your girl some love, okay? Subscribe to my channel. I'm new to this, but I have loads of information in stock for you. So subscribe to my channel, press the notification bell so that you will get to see all my new videos, okay? For any questions, please put it down in the comment section. I will reply them, or if I need to make another video based on your questions, I will do that, okay? All right, if you like this video, also share it to your friends and family so that they will benefit. I love you all. Take care.